Sandeshta speaking mulai. Good evening, everyone. My name is Simran Chaudhary. On behalf of Voice of Healthcare, I warmly welcome you to the panel discussion Breathe Easy, Prioritizing Lung Health for All, organized by Voice of Healthcare and supported by Pfizer. As we have gathered during the Lung Cancer Awareness Month, this event is more than a moment of observance. It is a call to action to deepen our understanding of lung cancer and to push for progress in prevention. So, early detection and treatment. Lung cancer remains one of the most leading cause of cancer-related deaths, according for nearly accounting for nearly 1.8 million lives lost globally each year. Beyond the statistics, this conversation is about the lives and the stories behind the numbers and the impact we can make together. Today, we will explore the recent advances in lung health treatment innovation, the critical importance of early diagnosis, and the environmental and lifestyle factors impacting lung health. This discussion is dedicated to the fostering a broader understanding and a stronger commitment to lung health with the hope of inspiring communities to prioritize respiratory wellness and take proactive steps for change. And we are honored to be joined by the panel of distinguished experts who will bring invaluable insights into lung cancer awareness and care. Together, let's work towards a future where everyone can truly breathe easy. Now, I'll be introducing the panelists for the today's discussion, starting with Professor Dr. D.K. Agarwalla, Medical Oncologist, Health Investigation Center, former faculty of AHPGIC, Cuttack, Odisha. Welcome to our show, sir. Thank you so much. Dr. Niti Raizada, Senior Director Medical Oncologist at Fortis, BG Road, Bangalore. Welcome to our show, ma'am.
Thanks so much.
Thank you. Dr. Deepak Koppaka, Senior Consultant Medical Oncologist at Care Hospital, Hyderabad. Welcome to our show, sir. Dr. Abhinav Zawar, Medical Oncologist at Kamalnayan Bajaj Hospital, Aurangabad, Maharashtra. Welcome to our show, Dr. Abhinav.
Thank you.
Thank you so much, sir. So, starting with the basic to learn about lung cancer. So, I'll start with Dr. D.K. Agarwalla. So, to start with, what exactly is lung cancer and how does it develop in the body?
Yeah, your caption is very interesting because, as I could see from the program, breathe easy. That itself sounds that. Just a minute. I can just mute my telephone. Fine. Sorry for it. Because the caption itself tells breathe easy means there is something which is going to compromise your breathing, and lung cancer is one of them. And what we exactly understand in a common man language, that it's an uncontrolled growth which is happening somewhere in our lung and which is continuously growing in size and making actually discomfort gradually, like breathlessness and others, bleeding or maybe hemoptysis. And there are many causes, initiating and stimulating them. And today's topic, the major cause, we know that in non-small cell cancer, there are a lot of mutagenic or genetic factors which are resulting in this. So, which might be a topic of, highlight in today's discussion. And basically, all this growth and development compromises both normal cell function in the lung and compromises the capacity. So that is how the healthy lung suffers. Basically, I would like to highlight that this is exactly what we get when we think of a lung cancer in a broad view.
Thank you so much, Dr. Agarwalla, for explaining us that. Moving on to my next question, Dr. Niti Raizada. Ma'am, why is lung cancer awareness so critical, especially in the current environment which we all are living, or should I say the metro cities should be more concerned about?
Simran, actually, you gave a very nice overview in the beginning. Well, why is it important? We need to know that this is a very critical malignancy, and awareness can change the dynamics substantially. This is the most common cause of cancer related death globally when you combine both gender, men and women. Almost a lakh patients are diagnosed each year in India. Second most common cause amongst men as cancer. Lung cancer is the second leading cause of cancer related diagnosis amongst men in India. And we know that most importantly, it is a preventable cancer. And we obviously know about tobacco and its effect. We know about cigarettes, we know about BD, cigar, pipes, secondhand smoking. We know about hookah. We also know that modern age has created more incidence of lung cancer by having alternatives like e-cigarettes, which uses vaporizers, and you get a sense of well-being. Oh well, you are not using cigarette, you're using an e-cigarette. Then we know the rising incidence of air pollution. Not just that, not just outdoor pollution, but indoor pollution, which women face because of coal dust or because of fumes in household settings. Then diesel fume, and then of course we are moving to an era in which occupational exposure is also increasing. In terms of mining, we have silica workers, we have asbestos, we have coal dust, and of course so many other exposures in occupation. So only awareness can change the dynamics. How can it change the dynamics? If it is diagnosed at a time when it is stage 1, 92% of the patients will survive. When they are diagnosed in stage 4B, almost nobody will survive. So, starting from stage 1 to stage 4, the dynamics can change substantially. And it is a screen diagnosed cancer. When you are at a high risk, we can do something to find out whether you actually have a very tiny lesion which can be cured. So, these all are some of the reasons why awareness is very critical.
You absolutely highlighted the correct points of where all the pollutions are and what all in what all forms it is actually affecting us, and that is why we have come to this point that this needs a broader awareness. So, Dr. Deepak, how can individual better understand the risk factors, and what should everyone know about the importance of self awareness and early detection? Uh, Maybe he has lost first due to some connection. Uh, Dr. Abhinav, could you answer the question for me? How can individual better understand the risk factors, and what should everyone know about the importance of self-awareness and early detection?
Yes, so the question is quite relevant for this time. Like the risk factors, as ma'am and sir has highlighted, smoking is the most important risk factor. It accounts for almost 90% of the lung malignancies, and it can be either from tobacco or smoking or hookah or marijuana. Anything they are known to cause, or they increase the risk for lung cancers. Then coming to the other risk factors, which we don't routinely see it, but they do account is one is the occupational, like the asbestos, then the radon exposure. So these are the few risk factors which do account for the lung cancers. And how do we creating awareness of quitting smoking is a very important, one of the most important step of preventing or decreasing the risk of lung cancer. Although even if a patient or a person who has been smoking for a few years, even if they quit smoking, the risk of cancer reduces substantially. So it is very important to make them understand, especially the youth who start using it at early age, and then it becomes addiction. And now with the e-cigarette, they feel like they are not smoking, which is we should have a campaign that yes, smoking, e-cigarette or anything or recreational drugs these are hazardous and these can lead to a increased risk of lung cancer.
Thank you so much, sir, for explaining us about that. And if we have to focus on the signs and symptoms, the key symptoms or signs of lung cancer that people should be vigilant about, when should they seek this medical advice? Dr. Abhinav, if you could answer that.
Yes, so the most common symptom which we see is unexplained cough for more than 2 to 3 weeks. If you are having persistent cough which is associated with some amount of blood tinged sputum, or you are having unexplained weight loss, you generally what happens is that we start taking, or in Indian setting they start taking AKT, which is TB drugs for TB, and then after few months also they are not responding. So cough which is unexplained, weight loss which is unexplained, cough which is associated with chest pain, cough which is associated with blood in the sputum. So these are few most common symptoms. Apart from this, the other symptoms are uh, uh, breathlessness. Patient feels breathing difficulty on walking few steps, or few or a 200 300 meter, they start having breathlessness which is unexplained at a young age, or maybe a elderly patient who is having unexplained breathlessness. Even the cardiac status is good, but they are having breathlessness. These are the few common symptoms which are directly related to the lung cancer. If because as your tagline is breathe easy, so these are the symptoms associated with lung. But if the lung malignancy has spread to other organs, like if it has spread to the bones, the patient can have persistent backache, or it can if it has spread to the brain, they can have a headache, giddiness, vomiting. So these are the rarer symptoms which we encounter at the later stages. But the early stages, the most common is cough, breathlessness, and weight loss. These are the common symptoms.
Thank you, Dr. Abhinav, for highlighting the signs and symptoms of lung cancer awareness so that people are aware of when they should actually seek advice of doctors, and what all things that could increase the risk of having lung cancer. Moving on to our next topic, that is early detection and screening, to Dr. Niti. Ma'am, how important is early detection in improving lung cancer outcomes, and what are the most effective screening methods that are available today?
So, Simran, as I was mentioning in my previous this thing, that outcome changes remarkably when they are diagnosed. Early diagnosis can actually pick up lung cancer in very less than centimeter size, and these are sometimes resectable or treated with local intent, and therefore the survival improves substantially. However, unfortunately, the dynamics is very different. When lung cancer is diagnosed, most 80 to 85% patients will be advanced stage, that is late stage 3 or stage 4, and that time the intent is not curative. Most of the time it is keeping the disease under control for a long time, and in the bargain have symptom control and achieve good quality of life. So the intent of treatment changes based on the stage they are diagnosed, and therefore it is important to find out whether you fall in the high risk category, and you can do some screening to diagnose yourself early. And at this, actually a lot of studies were done on various type of screening. There were x-ray tried in the past, and we found out that only larger lesions can be picked, and they cannot be a good screening modality. Sputum test was found whether there can be abnormal cells detected in the sputum. In fact, including NGS techniques and all just on sputum analysis. However, they are at this juncture not standard of care, and what is currently approved is just doing a low dose CT scan of the chest. And this low dose CT scan of the chest is recommended in a person who's actually high risk for developing lung cancer. And the people who are high risk for developing lung cancer are the people who are chronic smokers with more than 20 pack year history, or they are either current smokers, or they have had smoking history in the past 15 years, starting from 50 years of age to about 80 years of age, done every once a year. So you, and these are actually recommendations derived from United States. We don't have Indian recommendation, because in our country we have opportunistic screening, that if I want to screen myself, I go to the hospital. There's no standard country guidelines in which they say that you should do this. But at this juncture, a chronic smoker with more than 20 pack year smoking history and who's either a current smoker or within the past 15 years who was smoker, once a year low dose CT scan of the chest, in which the radiation exposure is very minimal. So the benefit of diagnosing an early stage lung cancer is substantial, and the tiny exposure which they have because of radiation is considered as insignificant in such patients. What is low dose CT chest? It's a rapid acquisition of CT images by taking thin slices of the chest. So it is almost like zero point 0.5 to 1 millimeter slices taken, and even a very tiny lesion can be diagnosed. And generally, 5 millimeter and above lesions are called as suspicious lesion, and they require either close monitoring, or if it is possible, we investigate it further by doing certain tests to find out whether they are cancerous or they need to be on further follow up.
Thanks a lot, now, for extensively explaining us all the methods and screening methods which are available today at the hospitals. And because of the medical advancements, it has become easier to detect such cancer at an early stage. As you said, there's no set of guidelines by our country that at this person at this age should proceed for the screening methods and all. It is all our judgment, our awareness that we should be aware of our health going forward for the medical checkups, regular blood tests, and all such tests required. Moving on to my next question to Dr. DK Agarwalla. So, at what age or stage in life should individual at risk of, should risk begin the regular screening for lung cancer? And how do screenings guidelines differ based on personal risk factors?
Well, uh, Simran, almost 90% of your question has already been answered by Niti. She has very clearly told that 50 to 80 years and people who are chronic smokers or maybe 20 packs per day for a long time, maybe more than 10 years, and people who have already kept quitted smoking for 15 years and resumed again are already in the high category risk because environmental factors also she has dealt workplace and other exposures she has very nicely elaborated all those points. And LDCT has definitely has got a superiority over conventional, X-ray because of the radiation dose received by the patient. These are actually, and we have got a superiority over, sputum test, which is no more tenable nowadays. Very few people do it in a regular clinical practice. These are the advantages he has very nicely elaborated. But out of the other, there are certain disadvantages which I would like to highlight that screening with LDCT particularly which might cause possible harm sometimes false positive. False positive cases has to be very which might lead some cases we have seen certain unnecessary invasive procedures for finding out a biopsy specimen and which comes out inflammatory, you feel yourself defeated. And overdiagnosis, we particularly mean by that overdiagnosis. This is, and though it is not clear how often it happens, but sometimes we have to be really careful. And the key points over all these things, what Nitu has already elaborated, that the risk of lung cancer clinical test, what should must include that finding a lung cancer doesn't improve your health or help you to live longer. False negative or false positive are equally bad. And X-ray is never superior, but LDCT is definitely the best alternative. And it is always better for the patients to talk to their doctor about possible risk and also what you need out of this screening test. So these are a few points which I would like to add over Niti. Otherwise, Niti has covered many things.
Thank you so much, Dr. Garwala, for adding on to the points which Dr. Niti has explained. And what you have added has also made a clarity as better understanding on the treatment options and the screening part for the lung cancer. My next question is Dr. Abhinav. So, what role does imaging technology like CT scan play in lung cancer detection, and how can it impact the early diagnosis of the disease?
CT scan is a very important modality, and it has a better sensitivity, better pickup rates as compared to X-ray, and it is the standard of standard of care for a early diagnosis in a high risk patient. Low dose CT scan is the best available option as of now. It has, though, although it has a low dose radiation exposure, which in turn can increase the risk, but the exposure is quite less. So yes, probably the best is low dose CT scan, and it is a very most important tool. Nowadays, as Sir has previously said, like, we generally don't do sputum analysis, or chest X-ray can be erroneous. We can miss small lesions which are less than 1 centimeter. So it is very difficult to pick up in an X-ray and a sputum test, which we routinely don't do in our clinical practice. And in a high-risk patient, best alternative we have is a low-dose CT scan available with us.
Thank you so much, Dr. Abhinav, for answering on the how important is CT scan for screening. My next question is Dr. Deepak. So, are there any workplace factors such as asbestos exposure that are linked to an increased risk of lung cancer? Dr. Deepak, can you hear me? Hello. Sir, can you hear me? I think he has some network issues. My Let's move on to the next segment, that is the treatment options and innovations. Dr. Niti, would you like to answer that? What are some of the most exciting recent advancements in lung cancer treatment and how they have changed the prognosis for patients?
Actually, Simran, I mean, I always say that oncology is the most evolving field. And every day we have something new. Every week we have something new which we can incorporate in our practice. But lung cancer has actually changed absolutely in a revolutionary way in the past 7 to 8 years. I think from 2016, when there was introduction of immunotherapy globally, and 2017 we even started having it in our country. So these 7 8 years have been a revolution of lung oncology, especially pulmonary oncology. But starting from diagnostics, I mean, we we had so much trust in doing tissue biopsies, but now we, even if we have a small sample, but we can, and we have confirmed malignancy, we can just draw blood, which is known as liquid biopsy, and get a lot of molecular information. We rely a lot on treating lung cancer even in early stage by genomic sequencing. We an ALK positive and an EGFR positive, even an early breast lung cancer will be requiring newer therapies. Then we always test whether they'll be sensitive for immunotherapy or not. We use RNA sequencing and transcriptomics in a subtype of lung cancer known as small cell lung cancer. Non-small cell lung cancer, which happens to be the most common type of lung cancer, is treated based on molecular subtype entirely. Not just the standard treatment, but we also try to find out whether there's a resistant pathway in which we can treat differently. So we have therapies like targeted therapies, we have targeted immunotherapies, antibody drug conjugates, which have changed the survival significantly. And let's say an EGFR positive lung cancer, which is actually a very important subset in Indian ethnicity, especially in women, can have a survival which can reach to up to a decade or even more, even in very advanced cancer. ALK positive lung cancer with lorlatinib or a drug which acts specifically on ALK has again a survival which has been incomparable as compared to any other targeted therapy. So revolutionary treatment in lung in past 10 years.
Thank you so much, Dr. Niti, for highlighting the advanced treatment options we have nowadays. My next question is to Dr. Agarwalla. So, personalized medicine is becoming a key focus in cancer treatment. So, can you explain how this approach is benefiting the lung cancer patients?
It's a brilliant question. Again, I would thank Niti that she has very lucidly covered a part of it very nicely. And as we know, from time immemorial, maybe we down the line about 40, 45 years, we had only armamentarium of surgery in minimal disease or stage one disease, and subsequently followed by chemo and radiation, particularly as a consolidation treatment in early lung cancer. But last couple of years, particularly maybe starting from 95 onwards, when we have got easier for analysis available and the trial where as everybody knows that, and that has really revolutionized our understanding gradually of the genomics of lung cancer. And towards 2000, and we have got anti-angiogenic drugs available, and which has further explored our understanding and control over fast growing tumors in many places. And so apart from that, the current generation, particularly immunotherapy, PD-L1 inhibitors, and many others, if all these things are sequentially planned in a very realistic as well as practical and pragmatic way, we have got probably non-small cell lung cancer is one of the finely treated category of the patient, and that is what we call as personalized therapy. Today, if it is really scaled down and mapped down in a fashion that the patient gets the best result, what we used to get 30 years before. So that's a real revolution. And all these specific multidisciplinary therapy arranged in real sequences are really going to change the future treatment of lung cancer and understanding of genomics and other, you know, immunotherapeutic modalities added to it. So the detection, surgery, followed by all systemic therapy, rationally done, is the current need as a personalized therapy in lung cancer, non-small cell lung cancer particularly.
Thank you so much, sir, for highlighting the role of personalized medicine in treating the lung cancer patients. My next question is to Dr. Abhinav. So, what are some of the common side effects associated with lung cancer treatment, and what can be done to help patients manage them effectively?
So the first part of the question, I think the answer is it's the every type of treatment have different side effect profile. So coming to chemotherapy part, we have lot of fatigue. These are the common symptoms: fatigue. You can have anemia, which is low hemoglobin. Then you can have low platelet count. The WBCs, the white blood cell can fall, and nausea, vomiting, post chemotherapy, and these typically they last for around after chemotherapy, maybe 4 to 5 days later, for a week or so. We have to face it, but these are easily manageable with the proper neutropenic precautions, which means you have a maintain the hygiene, wash your hands, and we have colony stimulating factors which we use often, which will help in preventing these fall in WBC, and which in turn patient lands up with infection. So these are the few common side effects which we see with chemotherapy, which is the fatigue, nausea, vomiting, and the fall in your blood parameters. So these are the commonly seen, and nausea, vomiting, which we now have lot many drugs. So hardly we see any side effect like a nausea, vomiting patient having persistent vomiting, which we rarely encounter. So which because of the drugs, because of the few drugs which we have, which takes care very easily the nausea, vomiting part. Coming to the targeted therapy, which we use now, we commonly use in our 30 to 40% of our patients targeted therapy, which are oral tablet form of drugs. So like geftinib, lorlatinib, or afatinib. So they have a different spectrum of side effects, which is apart from this nausea, vomiting, they have you have rashes on your hands or on your face or on your trunk. You can have skin rashes. Then you can have loose motion, oral mouth ulcers. So for this, we generally try to we give them some kind of minimum dose of steroids, or we ask them to have mouth gargles, and sometimes we have to decrease the dose of our drug or stop it for intermittent time period, and then we restart it. These are the few common side effects with targeted therapy. then the newer generation have a different set of side effects, like you can have some kind of fatigue, or you can have blood parameters like a cholesterol level can go here and there. So but these side effects are easily manageable as compared to with proper medications and proper consultation, and they are like easily manageable. And as per the drug, the side effect profile varies, so generally the consulting oncologist will explain them, and these are manageable, so we should not get scared of these side effects, which I generally see. Like the patient comes with a lot of fear that chemotherapy or targeted therapy will harm them more, rather than improve their quality. I think that is just like maybe 1 to 2% of the patients who have serious side effect. Most of them tolerate it nicely, and the quality of life which they improve, like especially the targeted drugs, it's too good. Like you cannot. We should somehow push our patient to for targeted therapy if the molecular test is positive. The upcoming drugs, which is the immunotherapy, they have a altogether different spectrum of side effect, which is autoimmune side effect. So which is also not seen at first few cycles. Maybe we can see at later point of point of treatment, like the maybe after third and fourth cycle. And these are autoimmune side effects wherein patient can have some kind of thyroid profile derangement, fatigue, and you can have some kind of skin rashes. So a proper keen observer, if we observe them, and if it is easily manageable. So we should not get scared of. We should not have that fear of these side effects, because these can be easily managed with the new drugs, with the new prophylactic drugs we use prior to the therapy or in during the therapy, and these side effects can be easily managed.
Thank you so much, Dr. Abhinav, for explaining us what all side effects a lung cancer patient, encounter with during the treatment, and how all it can be, you know, we can tackle that. So thank you so much for that. Moving on to my next segment, that is emotional and physical, psychological support. My question is to Dr. Deepak. So welcome to our show. I believe now we have a proper connection with you, so we
Sorry.
can actually have a question answers with you. So, sir, talking about lung cancer, so lung cancer can take an emotional toll on patients and their families. So, what are some ways to provide better psychological and emotional support throughout the treatment process?
Yeah. So, like my previous speakers have been very elaborately conveying that lung cancer patients are now getting the best treatment. So, eventually, these patients are doing well for a very long time, and that's the best part of it. They are on these treatments for a very long time. There are very few side effects, and they get back to their normal life. All said and done, there are also some issues these patients face, which actually are a part of their treatments and a part of their life these days. One of the most common issues that oncologists here would also agree that these patients encounter is the financial turmoil that they go while they're on these treatments. And always lung cancer comes with the stigma that it's most often related to smoking, and they also have to live with the stigma. And that also pays, it always plays in the back of their mind, and they also have to face this stigma of the disease. Many other things. Also, some treatments have some effects which can neurocognitively bring down their wellness, and that can also compound on the stress that they're already going through. So these are the issues that patients face, and we all encounter such situations in our practice. How do we overcome this? There are multiple ways. There are multiple support systems that the MNCs, the pharma companies have in place for patients on these treatments. That has actually bring down the cost of treatment significantly. Like immunotherapy, all of us are aware that when it was initially launched, it was prohibitively expensive, and there are numerous support programs that are currently in place that have brought down the cost. So financially, that is one support these patients can always bank on. Next, coming to the emotional supports, I advocate my patients to join support groups. one very vibrant and very active support group that I encounter frequently is the ALK positive lung cancer patient support group. Rise to Cancer Survivor, I think is the name of the foundation. It does amazing work. I see very clear discussions, very neat discussions happening on this platform, and patients always go back to their support groups and ask questions whenever there's a change in treatment. They come back with treatments and very newer advances that even we fail to notice, and they would always come back and say that, sir, in the support group there is an active discussion, would this treatment benefit you? I think that is one support group that I see that patients have very vibrant discussions and patients really bank on that support group. More and more such support groups are actively needed in lung cancer space. This is one specific group that I closely follow, and my patients keep telling me what's happening in support group. But I see these group of patients are always more engaging. They're more aware about their disease, and their outlook towards the disease is always positive. So I think support groups are something that we need to form. We need to actively engage our patients on. Financial systems are always in place, and I think the government also needs to understand that there needs more support for these patients who are doing well on these treatments. Yeah, that's my 2 cents on it.
Thank you so much, Dr. Deepak, for elaborating on the emotional toll on the patients which they go through. My next question is Dr. Niti. Ma'am, how important it is to involve family and friends in the patient's cancer journey, and what can caregivers do to offer that meaningful support to them?
This is a very interesting question, Simran. That caregiver is a very important, support system in a patient's journey. Patient have a parallel journey, and caregivers are parallelly having a different journey. I mean, we know with the impact of cancer is first socially, psychologically, and all this, and of course economically, occupation changes. In our country we have younger patients who develop cancer. We have often patients in their 40s and 50s, which is peak of your career, developing cancer. Some patients develop cancer in their late 30s when they have a young family in their house. So there's a huge social impact, there's a huge psychological impact. And the journey is kind of very remarkably altered with the way caregiver support is there. If you have a caregiver who's very reassuring, who's very supportive, I mean, the entire journey of the patient becomes very different because the attitude changes. Family support is so vital, the way they take care of the person who has cancer. They don't socially isolate the person, they give the right kind of care, including nutrition. Occupation also sometimes suffer, and therefore economic loss, which can be supported by the family. There can be change of your working style. I mean, which you were kind of work, you may have a very active lifestyle, now it becomes more sedentary. You have to come to the hospital regularly, so somebody has to come along with you. That person also has a job loss. So all these things are very important, and therefore the journey of patient may be all of this social, psychological, emotional. But caregiver also go through a journey. There is a caregiver burden, there is a caregiver trauma, there's a caregiver fatigue and washout. So I mean, we have to take care of the entire family when we are treating. It cannot be an individual, it has to be the entire support system which has to be taken care of. And that's when I mean, that Deepak said, even a support group physically online is very important. So it is important to educate the person. That could be a doctor's responsibility or the medical team's responsibility, but taking care of the entire family during this journey is very important, so that the well-being is not just one dimension but a holistic journey which is taken care of.
You rightly said, ma'am. The caregiver also goes through a lot of things, and the kind of efforts they put in, the traumas they also see when they are with the patient. And also, I must say that I've came across a person who was handicapped, and she had that caregiver. The kind of understanding level they both have, and even if she's into a depression, she's shouting or anything, is that person is there to understand. This is because of maybe the hormonal, or the things overthinking, or let's say some side effects of the drugs or medication. So I think that is commendable, that the efforts and the contribution they give for the patient. My next question is to Dr. DK Agarwalla. So we, like Dr. Deepak also mentioned about the self-help groups and mentioned few of the names. So we know nowadays there's a lot of self help groups, support groups, and how they are helping the patients and the family, whether in terms of financial or mental or emotional support, in terms of all. So what role do support groups both in person and online play in the emotional recovery of lung cancer patients?
Yeah, give me a minute more. And my job has been made very easy by my two previous speakers who have elaborately described all these facets. I'll have to make a thumb rule now to just touch on the key points. The first thing, very important in our support group, both person, online, or a emotional recovery of our patients are concerned, the best thing is that talk about it, talk about it, and talk about it till we have fully understood. That is what we practice. Share. Sharing is caring. You must share with whom? Your friends, your family, and your near and dear ones, and particularly caregivers who really take care. So share always ends with good care. Seek proper support system through whom you can get a lot of exchanges and guidance, particularly if you have got a specific lung cancer survival community and a group or a WhatsApp group. There are, so if you are connected with them, day to day, problems and everything you can share, and you can get a cue and answer from many of them, which you will find that fits into your own environment and your own circumstances, and you learn how to identify them and how to win and control them. Second thing is that the easiest way to educate yourself. Nobody
Yes.
educated. You need to educate yourself. You have to learn from your medical team. You have to learn from your peers and educate yourself through the process while going through the diagnosis, treatment, and so on and so forth. And keep open your dialogue with all support groups. All support groups means all caregivers, anyway. And the honest discussion with loved ones, particularly, that helps, and all healthcare providers, because that helps really in your bad days. Emotional self care.
So
The next point is very important, which actually has been, and we have in our system of our culture and religion and culture, and we have been brought up in such a system where emotional care in the family and self has been very extremely good. And I would say that in our culture also, we have got like yogas and other systems of medicines where we can, bottom line is that how to take care of health in a better way, and particularly out of which breathing.
hmm.
Your lung cancer is connected with breathing. You must know to take care of your breath and learn how to breathe properly, so that our ancestral system of yoga can teach volumes about it, like pranayama and other things. These are really good, and it has helped
So
improving your oxygen as well as oxygen saturation. And secondly, you must have a good sleep. Keep yourself devoid of anxieties and worries, so that if you get a good sleep in the night, particularly 7 to 8 hours, nothing like that. So that is one thing which we should be very careful. So don't waste time in bothering many things in the daytime, but night you must have a good sleep. You must have proper nutrition. Recovery is directly proportional. Your nutrition is good, and I'm not going to elaborate what nutrition and everything. They can suss it out. But nutrition is essential for our patients for a good recovery and a moderate exercise.
so
Even if you use your fingers, toes, and legs, hands, even if you are even bedridden or you are in a wheelchair or anything, you can still exercise, do some exercise. That is more important. That keeps your body active. And finally, coping. Coping day to day and day, every day. So that is very important. Write a small journal, write a letter to yourself. Sometimes even after that you can be written throughout, but you'll have a satisfaction that I have written something, and I'm talking to myself. about my problem. Many times you have to lean on community functions, community activities, so that that gives a lot of opportunity for you to interact with people and different kind of people and forget your worries and find activities out of your daily routine which always and invariably always brings you joy and happiness. That's my final comment. And I think a mixture of all these things, whatever my two predecessors have already talked, have been very brilliantly, but scientifically they are very, very nice. But these are other additions which, as I understand over years of our experience, do a lot of benefit to person's emotion, psychology, and further development.
Thank you so much, sir. You have added a lot to this, and thank you so much for elaborating the points which are very crucial for the support system for the cancer lung cancer sub patients, because all these I believe are required for the recovery phase. The doctors are giving their best treatment they can, but other than the treatment they also need that emotional support, and the pointers which you explained has added a lot more, awareness and clarity, not just the patients and the family, and also the friends, colleagues, or the people associated with them, to know how important it is for the cancer patient. So thank you so much, Dr. Agarwalla, for adding that and other crucial important points as well. My next question is to Dr. Abhinav. So, how can we combat the stigma surrounding the lung cancer, especially in more conservative or less informed communities, to ensure that people seek help early? Because if we talk about the conservative areas, financially they're also at a back step. So they feel if they go to doctors for the treatment or for the screening part, it will cost a lot of money. And in case they are diagnosed with some of the disease, that is more a kind of a burden for them.
Yes, so that's a very important question, especially where I practice. I see a lot of patients who are from the less informed community. They have logistic issues. They have financial. They feel that it's a burden, and cancer do, like, maybe in a metro we don't have so much stigma around cancer, but in the peripheries, in the towns, still you have a cancer stigma that yes, this patient is going to live for 3 6 months. So the first important thing as a health professional is, I think we should counsel them, motivate them for the therapy, and we have to do a campaign for regarding that cancer is treatable, and in few cases it can be cured. Early treatment can cure it. So first step is the health professional. They should motivate their patient. They should create a awareness campaign regarding the same, that yes, this is treatable, and even if it is not curable, it is treatable, and it is not just palliation. It is not just increasing the lifespan. We are improving with the lifespan. We are improving the quality of life. So if you see at the ALK positive lung cancer, they can live more than 5 years, which is it was unheard. Maybe 5 6 years back, it was unheard of. Your lung cancer stage 4 patient can survive more than 5 years, and without minimum side effects. And you can somehow, sometimes you will have no side effect also, here and there few side effect. So we should make them like, this is treatable, this is curable, this is, and we have advancements. We have lot of therapies which are with minimum side effects. So they feel that they have lot of side effects, and they can die with the side effects. So this the stigma around the therapy, we should bring into account that also, that yes, treatment is without any side effects or minimum side effects. Then other is burden. Yes, we cannot afford it. Once you have cancer, so they feel like it is like exhausting. So if you look at with the perspective of the patient, if you tell you'll have to come for 6 cycles, so arranging a bus or a travel from your native place to the place, your tertiary center, coming back, going back. So it's a taxing thing for the patient, not only for the patient, but the accompanying relative. So but with the government's funded schemes, we and with the social support, we have few foundation. I think we care does that. They give crizotinib, crizal with free of cost. If you are in the BPL category or you are in the economically weaker, they support you. So, and with the government funded schemes, now they have started including targeted therapy. So, this part also, the financial burden can be easily handled. Now, coming to the other aspect, we have lot of trust, we have lot of social supports, NGOs, which are providing care, which are funding. So, and then comes the trials. So, we should make it's our duty it's our duty that we should make motivate them that this is not taxing, this is not financial burden, but a motivation from their part is also required to come to the tertiary center, take your treatment and go back with minimum side effect. So I think these few things we have to emphasize. We have to create a awareness in our society. We should have health camps, and we should make people realize that these few things can really have a big impact on your life. It is not just cure; it is also a good palliation. Is improving your life with a good quality of life. That is very important.
Thank you so much, Dr. Abhinav, for explaining on the part where you, like you said, you actually deal with all those stigmas around you where you are actually currently serving. So I believe you're the best. You were the best person to discuss this about for the today's panel. Moving on to the next segment of the show, that is post treatment and care survivorship. My question is to Dr. Deepak. Sir, what are the primary challenges that lung cancer survivors face after completing the treatment, and how can they be best navigate navigate life for the post recovery? So you're on mute.
A nice question. Actually, completion of treatment, I think most of our patients are on treatment. I mean, the disease might not be really visible on the PET scan or the scans that we do to say that they're doing well, but they continue to be on treatment most often. And like Dr. Abhinav was clearly saying that they're on these targeted therapies and these patients are doing very well. Like the support group that I was talking previously, I got one message from my old patient saying that there was one patient in the support group who's been on one pill, that is crizotinib, for the last 12 years, and he's the longest survivor on crizotinib, even as per the records. So, and they do very well. I mean, 12 years on just two pills, one in the morning and one in the evening. That's amazing, and never heard of in patients with stage 4 lung cancer. The good part here is they're doing well, but they also have to carry this burden of the treatment and the side effects. So the first thing that most of these patients who do well usually have a problem is with the smaller side effects. You know, having some leg swelling one day is fine, but having a leg swelling constantly, having to difficulty in wearing the regular shoes, their footwear, wearing the clothes that become tight, they gain weight. These smaller side effects, but eventually there are medications to mitigate these. There are some home remedies to really mitigate these. So the most common thing that bothers patient is the chronic side effects that they have after taking the treatment or being on the treatment. They might not be really big side effects, but these are side effects that make an impact, have subtle difference in their life, and I think these can be addressed by a few medications and most often with home remedies like lifting their leg while they sleep, wearing stockings while they walk or stand for a longer time. Smaller things, but they make difference. The second thing is they always have this fear that the disease might recur. They might have this the next scan probably. I talk to these patients just before they scan, and they always say, "Sir, will the scan be fine?" You know, things go fine once in 6 months. Once we try to assess where the disease is, they're always concerned. What will the scan show? And this fear of recurrence is something that always bothers these patients who are doing well for a long time. Reiterating that leading a very healthy lifestyle, stopping smoking. Smoking cessation is essential, and it plays a very big deal in having a significant impact in reducing the risk of recurrence. Emphasizing that these smaller details really help, probably will help them overcome this fear of recurrence. The stigma, like Dr. Abhinav was very clearly saying, there is always the stigma that they carry when they are diagnosed with lung cancer. One, the stigma of not doing well for a long time. Second, the stigma that most often lung cancer is related to smoking. But on the contrary, a significant proportion of lung cancers are not because of smoking. But once they say that they are having lung cancer, they're always judged that they probably got this because they were smoking at some point in time in their life. Probably we have to play a role as a doctor community to educate the general public that lung cancer is not always because of smoking, and also we have to educate our patients that stigma is how you perceive it, and you always have to put a brave face and get over it, and then face the world the way it is. uh, there are emotional and financial constraints that these patients always are worried about. I think companies, the government, and all of them have to play some role in trying to mitigate these burden patients face. So I think these are my takes on what patients regularly encounter while they come on their treatments or off their treatments. I think having a healthy discussion, spending some time with your patient, and like Dr. Agarwalla sir told, I think there are things beyond treatment. There are things beyond the medicines that we give. We always have to focus on the patient in a holistic view. Talk to their caregivers, like Dr. Niti ma'am was saying, and support them, and make their journey as hassle free as possible.
Thank you so much, Dr. Deepak, for explaining us this extensively and putting that spotlight on about the do's and don'ts of specifically about the post treatment recovery journey. And like you said, the things which are, or let's say, a person is not that of recovery or the treatment process. Keeping that in mind, my next question to Dr. Niti, ma'am, how important is follow-up care and monitoring for lung cancer survivors, and what should they be aware to prevent this reoccurrence?
So, Simran, when we talk about definition of survivor, a survivor would be a person from the day you are diagnosed till the end of life. So it's the entire journey. A long-term cancer survivor is a person who has survived more than 5 years. And we have to remember that lung cancer, when we talk about recurrence or the disease coming back again, it's most often in the first 2 years. So first 2 years is very intense monitoring. And we, for early stage cancer, we anyway do at least 5 years of monitoring. But for a person who's advanced stage, he will always require close monitoring. And well, most important aspect is right treatment. Then second important aspect which everybody mentioned is right supportive care, which includes what is your etiology, whether you are continued to have the same risk factors or you have actually brought it down. So if you're a smoker, have we taken care of your lung health? Have we done something else to improve your lung overall lung fitness? Then have we done anything to improve your general fitness? You're biologically fit to have continue the same treatment, or I mean, generally improved after your treatment. Then third thing is when any comorbidities, whether they are managed properly, if you're hypertensive, diabetic, if you have a cardiac ailment, because most of the patients will be elderly, have those things been taken care of. So you take care of the cancer, but you also have to take care of the comorbidities. And fourthly, whether the nutrition during treatment and subsequently has been good. Fifth is, which everybody mentioned, Deepak specifically mentioned, that treatment related issues, have those been taken care of. So the patient was on certain treatment and had a certain problem. Now those things have been taken care of. For long-term survivors, we also have to look for second malignancies, whether patient has recurrence of the same cancer, or another type of cancer. And few lifestyle factors which we all know about, not just for lung cancer, but for most of the cancers, is well good diet, which includes rich fruits, good fruits and vegetables in diet. Wherever possible, avoid red meat. Some kind of moderate physical activity, which Dr. Agarwalla specifically mentioned, and of course Dr. Deepak also mentioned, moderate physical activity, incorporating some kind of stretching exercise like yoga, pranayam, which takes care of your lung fitness and your general physical fitness. Also, some kind of mindfulness practice which can be done to not just manage the disease but also the attitude and your environment, how you can change around it. And then of course there, one thing which we have to understand is supplements have to be taken with care. We know that we all have our friends and relatives located in abroad, and everybody will come with a gift of some kind of a supplement. So you have to be very careful what supplements you are taking, whether they are wise supplements or not. There have been a lot of debate of getting extra vitamin supplements in cancer, whether they are good or they can actually be harmful. Certain type of antioxidant supplements which could be actually not logical. And we obviously all talk about alternative medicine. All of us will have a question, all patients would have a question about alternative medicine. So those all should be addressed appropriately.
Thank you so much, ma'am, for explaining us the importance and do's and don'ts for the post recovery for the lung cancer and the survivor's life after that. My last question is to Dr. D.K. Agarwalla. So, what more can be done to raise awareness about lung cancer in non smokers, and how can we ensure that lung cancer is seen as a disease that affects everyone? So we talked about the post treatment and everything, but what about those who has not got it? And they should still be vigilant about, specifically nowadays, the smoke, the pollution which we see breathe every time, every second, who lives in metro cities, or dealing with this every day.
Yeah, if it is my conclusion, I would
So
like to say that it is basic thing is education, education, and education. Educate yourself. That is most important, and learn actually from others that how they have passed their life. It's a life history. So, and what challenges has been faced. So these are a few cues which actually makes you understand that if you really want to learn where we stand today, and we are fortunate that we in past dynamics of past 50 years, the paradigm has totally been shifted as far as lung cancer treatment is concerned today, as we have already discussed the
so
scientific part of it, the ethical part of it, as well as the social part of it. And the final conclusion, which our all speakers I have said, I'm really happy that they have dealt the supporting system, supporting care so nicely. If I am asked to give a one line conclusion, or maybe one or two line conclusion, supporting a cancer patients before, during, and after cancer treatment, the total journey. The only thing which needs to be educated is that you improve activity, remain active, and eat well. Niti has clearly told, and as we have also already told, how important it is that if you maintain nutrition, the recovery becomes faster. Stop initiating causes like smoking
So,
or work environment where you get such type of cancer more frequently. And all these things are definitely proven to decrease all the side effects even after treatment also, and improve the patient outcome and well-being, definitely, for a better future. But the challenge is to provide a total package of interventions which starts, we should be acceptable to the patient as well as fits within their treatment or patient pathway, so that there should not be any conflict in diagnosis as well as therapeutic activities. There are a lot of patient assistance programs and lot of support cares which must be made available and must be taken full use of it during the course of journey, and which it might be a game changer for the future therapeutic armamentarium of lung cancer. I remember a small thing because while we were working in Royal Marsden about 3 decades back, I asked a question to their support system and social group. But what is the secret of success? Because they used to advocate that what is not possible here probably is not possible
yes,
anywhere in the world. So the only answer they told in 2 lines. The first line was, "Our doctors are sweeter than sweet." I've never heard that sentence before. And the second was, "Our patients are our brand ambassadors." Because if you talk to our patients, they are so satisfied and they will volumes of cues and guidelines to our other patients, so that reduces our work burden a lot. So this is the final comment I would like to give. Thank you very much, and thanks for all the participants who have been with us this evening. And it was a wonderful discussion. We love it. Thanks a lot. all of you.
Thank you so much, sir, for the contribution you have given to us and to raise this awareness on lung cancer, which is one of the most important issue at this moment. As we all have seen the post Diwali environment, which has caused a lot of disturbance. I think this is very much required, whether the person is smoker or a non-smoker. It is very important for everyone to be vigilant and aware about their lung health and how can they live a healthy life with the combination of a good nutritionist food, rich diet, exercise, sleep, and bit of yoga for their lung health and for their internal health. I would like to thank all the speakers present here, have taken part for this very crucial discussion and contributing their time, efforts, insights, and experiences with us for raising this awareness and becoming one of the voices to raise this awareness. Thank you so much, all.
Thank you.
Thanks a lot. Thanks.
Thank you, sir. Thank you.